Hi, welcome to Learn how to prepare and crack BTSC Medical Officer Recruitment. Bihar Technical Service Commission has oftenly given an employment notification for the recruitment of specialist medical officer and general medical officer vacancies. Those candidates who are interested in the vacancy details and if you are eligible, you can watch this video and prepare well based on this video. Let's see application fee for BTSC Medical Officer exam. Approximately for general OPSC EWS candidate for other states rupees 200. For SC, ST, EBC women rupees 50. Payment mode only online. Here debit, credit card and internet banking accepted. Let's see age limit for BTSC Medical Officer exam. Approximately for general male 37 years, for general female 40 years, for BC or OBC candidates 40 years, for SC ST candidates 42 years. Age relaxation is applicable as per the rules. Academic qualification needed for this exam. Interested candidates applying for BTSC Medical Officer post must have MBBS registration from Medical Council of India or Bihar State Medical Council. Let's see application process for BTSC Medical Officer exam. First visit the official website www.pariksha.nic.in. Then click on the tab for registration. After completing registration, fill the information like type of recruitment, name, father's or husband's name, domicile state, category, subcategory, date of birth, gender, marital status, contact number, email ID, qualification details and other relevant informations. Candidates have to pay the application fee as per the category by entering registration number, date of birth and gender. The payment can be done through net banking, debit and credit card and other payment modes. In this stage, candidate must mention the education and experience details, photo and signature details, enter permanent address and declaration segment. After reviewing the details, submit the application form and save the confirmation page. Let's see selection process for this exam. The selection process of candidate for the post of medical officer will be done on the basis of marks secured in MBBS and their performance in interview. Based on the cumulative marks of academic and performance in the interview, the merit list will be drawn. Based on that, candidates will be selected for appointment as per the performance and rank position in merit list. Let's see preparation tips for this BTSC Medical Officer exam. Dress like a medical professional. The first factor on which you will be judged in your dressing sense. So be smart enough to dress for the job you want. Here are some pointers to remember while dressing up. The mark of a medical professional is being appealing to the patients and yet not too attractive. So keep that in mind while getting ready. Don't use loud colors. Keep it subtle. Stick to light blue, rose or yellow. If you are a male, wear a plain shirt. If you are a female, stick to a sari or a plain formal shirt. You may use deodorant but avoid strong colognes. Have kept hair, don't let it loose. Comb it neatly and wear it as a bun in case it is long. Your tone and language counts. There are different tones and language dictions that different professionals require. For instance, an army person's tone must be firm and loud. The language must be sharp and clear for others to get commands right at one go. Similarly, a medical professional must be polite, firm and gentle with their tone. The language must be simple and effective. The way you explain questions speaks about the way you could handle patients. Some core topics and questions. Expect questions commonly from gynecology, obstetrics, pediatrics and homeopathy related subjects. Your presence of mind can be tested through questions such as how would you handle emergency cases, what would you do when you are unable to diagnose the cause for an ailment, Would you still treat the patient? A patient with acute illness has come to meet you on one hand and on another hand. A politician and two doctors have come to meet you. Whom will you prioritize and why? Display poise. Being a doctor means keeping you calm even when there is a difficult situation. The way you could handle any given situation will be tested based on the posture and confidence you have during the interview. Do not forget with your hands lest you might appear tensed. Keep calm. It is okay to take a minute or two to think, but don't panic. Show a mature behavior through your body language and answer the assured that you are capable of handling many patients. Listen more. As a doctor, you must be all ears to first listen and then observe a patient and not jump into the assumed necessary treatment. When you keep your ears and mind open to all that is said, you will be able to arrive at a more accurate diagnosis. Do not cut a conversation in the middle to answer or express your views. Although you might seem confident at that point, listening more will elevate your points during the evaluation. The final one is avoid overconfidence. While formally greeting the interviewers as soon as you enter the room would be appreciated, do not show over enthusiasm that can be mistaken for overconfidence. If you do not know the answer to a question, a sorry would be received better than a wrong answer, as you will not be excused for wrong clinical judgment towards patients as a doctor. But admitting that you do not know something can help you to either redirect the patient or seek an expert advice and confidently go on with the treatment. Hence, the way you answer will be used to judge your attitude too. We hope all the above information will help you. For reference book, please go through the description section under this video. Thanks for watching. Thank you.